His patient certainly would say he's a mighty good man. In conversation with Mufazzal Lakrawala, aka Muffi, and we're talking bariatric surgery, obesity, and a whole lot more. So, is it scarless, scarred? How does it work? The mechanics of it?
So basically, bariatric surgery, the only person who's most scarred is the victim himself, the person who's delving with obesity. Okay, they are scarred for life, and most of them, sometimes I've operated on young girls who've been suicidal, a huge host of social issues, psychological issues that they dealt with. But as far as the surgery goes, most of the surgery is done laparoscopic, so you don't need any big cuts and stuff like that. But of late, over the last maybe 3 years, we've been doing it only through your belly button. That's the only scarred area of the human abdomen anatomy. And we've done the largest number of cases now in the world. So I get invited world over just to operate and demonstrate scarless surgery. Like I'm just going to Saudi Arabia next week just to demonstrate scarless. The first time, I think, luckily they're inviting a brown compared to a white. The Saudis and their fixation with white skin.
Full party. So basically, wives whose husbands go away for business trips and then they come back and they find
That's
a new
secret, Rishi. That's a trade secret. But if a girl were to walk on a beach and has lost 50-60 kilos and doesn't have a scar, maybe you could give credit to us.
You don't get invited to a lot of parties, do you? At least not of your patients.
So sometimes it socially becomes an embarrassment because I don't know whether to acknowledge a person at a party or not to acknowledge that person. And sometimes they just wonder, he's being so rude, he's not even saying hello to us.
I know the equivalent of this is hair transplant surgeons. You know, everybody's doing it these days. So I have stayed away from it, though people are constantly telling me, no, you should do it and this and that. I don't think even they get invited by men. So I met one of them and who said exactly the same thing as you're saying. Now you put a twist on it by saying it happens with you also. Well, such is life. Listen, your coordinates, where can people find out more about you? Do you have a website? Do you put up stuff somewhere?
So actually I write a blog.
Beautiful,
and
beautiful.
It's there on tumblr.com, Dr. Muffi at tumblr.com. We also have a website.
Just search for Dr. Muffi.
Yeah, Dr. Muffi is this thing. We are on Twitter, we are on Facebook. Dr. Muffi just goes with that. And you'll probably be able to read about it. If you type in Dr. Muffi, you'll probably get enough of stuff on us.
And this is MUFFI, yeah?
MUFFI, yeah.
Okay. And doctor is just the DR.
Yeah, and our websites are www.codsindia.com, CODS, as in Center for Obesity and Digestive Surgery, and India.com. So that's it.
Okay, we're going to have some messages. If you have any questions, please ask. One space your question and name to 53650. I've just put up the first picture of Dabber Muffi in studio at the rate of HRISHIKAY and Facebook.com/HRISHIKAY. You might want to comment on that and ask any questions. When we come back, a bit about his scuba diving and more obesity talk.